I'm Jeff Oliverio, and let's queer up health. Texas Children's Hospital settles lawsuit creating Detransition clinic. Texas Attorney General Ken Paxton has finalized a $10 million settlement with Texas Children's Hospital following a state and federal investigation into Medicaid billing and gender-affirming care for minors. Under the terms of the agreement, the Houston-based medical center, the nation's largest children's hospital, will pay $10 million, terminate hospital privileges for physicians involved in gender transition care for youth, and open a dedicated detransition clinic to provide free care over the next 5 years. Texas Children's Hospital stated that it agreed to the settlement to avoid prolonged, costly litigation and focus its resources on patient care, noting that internal reviews showed no violation of law. LGBTQ advocacy organizations, including Equality Texas, condemned the agreement, contending that state officials coerced the hospital into establishing a clinic based on political motives rather than medical consensus. Well, Ken Paxton obviously is, running in Texas right now, and again, all of these politicians are using, all of these tactics to divert attention from the real problems that hospitals are actually closing in Texas that people need care for. People can't afford health care in Texas because I believe they rejected all of the, Medicaid expansion in Texas. And they're running doctors out of the state, which could be help servicing, youth in general, not just transgender youth. So, again, I hope that people in Texas are paying close attention to this and also focusing on the issues that matter, which is not about gender affirming care for minors.
And I think that across the board, politics are telling the medical community what they can and cannot do. When the medical community, if my doctor says that I should have this, I don't want a politician to be able to come in and say, no, you can't have that. So all of these politicians who are trying to make decisions based on medicine, it's ridiculous. And, they're going to open a detransition clinic. It will probably be the quietest clinic around. I mean,
every person in the world who ever wanted to detransition who show up at the same clinic, you can stay in office. I mean,
you couldn't afford it.
It's not even a thing.
It's ridiculous.
And this is just one more, and this is decades in the making though, of governing by demonization, of governing by just ad hominem attacks just because of who you are, because you're Muslim or because you're gay or because you're transgender, just because of this thing that you are automatically a threat. Meanwhile, those people are the ones actually threatened. Like there's no threat. Some children are trans, and some trans kids are lucky enough to have parents that will walk with them and support them through the journey. And now to be denied that by the state, that is some Orwellian bullshit. That's what's frightening. Not that there are trans kids in the world, because guess what, there are. But that they can't get the health care they need because some white cisgender, supposedly straight guy decided it was wrong. So they're running on demonizing people rather than offering, this isn't going to house anybody. This isn't going to help anyone get an education. This isn't going to help anyone have medical care. This isn't going to help anyone at all. But this tiny sliver of the population will be harmed. And that's just the price of doing business for them.
It's such a bully move. It feels like a schoolyard bully getting, this hospital up against a corner, shoving them in the face and saying, you're going to do what I say, and like grabbing them and saying, say you're sorry, but you're the one that kicked me, but you're going to say you're sorry, so it's like basically saying, you're going to do the thing that I'm telling you to do. So it's very, like you said, it's very Orwellian, and it's an inverse. It's the bad guy, saying I'm doing the good thing when really it's really the good people at the hospital that are being forced to do the bad thing. So I'm sure it's going to be a very quiet office, detransition. Right. And I think you're absolutely right. If all the people that want to detransition, go there, it's still going to be very quiet, and they'll check a box that they have one, and hopefully it gets Ken Paxton out of their hair. So
Yeah, and you know what's interesting is these are the same people who are advocating for parents' rights. Parents' rights. If a parent wants to send their kid to a conversion camp, they should be able to do it. Parents' rights. But no, you can't. You don't have parents' rights for health care.
And everything
And so
in
it's like
schools and
so
preschools
hypocritical.
and
Exactly.
it's all you're being indoctrinated. If anything, like you're taught empathy or diversity or to respect people, you're indoctrinating people. But forcing people to be denied medical care, that's not indoctrination.
Right.
Oh,
yeah.
I can't. It's really
the hypocrisy is disgusting.
I am 32 years old, but look at me. It's from all of this anxiety and craziness.
I tried to tell you about my Botox person and you wouldn't listen. So that's what you get.
Right?
Well, there's no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by sharing them and subscribing to Queer News Tonight.